In the best way, in the American form, it's mal-D débarquement, but it's also what we call a centrally maintained vestibulopathy. So what that means, we have our inner ear, and that's part of the peripheral vestibular apparatus. So it's periphery, right? Like our peripheral nerves, things that are in our body. Our central nervous system controls it. It's constantly sending information to our central nervous system, but it's technically a little different, right? Those pathways fire centrally to the brain. So in the brain, we have very important vestibular nuclei that receive the information from our vestibular apparatus in the inner ear. So when we move, it sends messages to these central pathways, and then the central pathways from the vestibular nuclei, they go to so many different areas. Emotionality, so the anxiety component, autonomic nervous system, controlling our blood pressure and our heart rate, right? We cannot have good autonomic function unless we have good information coming from our vestibular system, okay? We will get cardiac pathology, we will get changes in our respiratory rate, we will get changes in blood flow, okay, both in the body and also in the brain. We'll get changes to the gut, so the blood flow to the gut, you already had issues with constipation, things like that, because of medications you were on, right? But then on top of that, we also see a correlation with gut ischemia. You get less blood flow to the gut when your autonomic nervous system is imbalanced, which happens when you have this vestibular imbalance going on as well. You also get changes in your cognitive network. So it's a big thing I look at when I see you coming in. You have the lack of facial expression, we call it hypomimia. It means just like the normal affects of like, you know, joy, sadness, things like that, just kind of blank, right? You have the slowness of movement. We call that bradykinesia, right? And so I start thinking what's happening in your frontal lobe, because we know that it's vital for your vestibular system to work for you. If it's not working well, other areas that are maybe not necessarily vital are going to come online and help stabilize you. It's going to be a compensation mechanism because you need to have some sort of stability within your vestibular and autonomic networks.